putting things in perspective, it seems to me the cuts we're talking about, I could be wrong, are possibly on inflated start points. In other words, if you looked at your chart, it looks like what the governor is proposing is somewhere back around the 2007, 2008 level. And since then, so much of our budgets have been subsidized and stimulated by our federal government. So my question is, are these the, according to this gentleman over here, are these the baselines we should be working from, or should we be going back to living within our confines of pre-stimulus? Okay.
Jim? So I guess for you, the question is, where did some of that run-up, at least in local government, come from?
Well, in our particular case, the run-up can pretty much be focused on increases in expenditure on public safety, and if you looked even closer, increases in expenditure on fire. And those were the two #1 public priorities. So other than that, we held the line. But I think that if you look throughout Florida, and if you looked at that curve for the legislature, there was some spending that went on that probably didn't need to go on, and to some degree, we're dealing with an adjustment there. But on the other hand, if you look at the places where the spending occurred in the state, it occurs, there's two things that drive the state budget. It's really not that hard. You talked about it. It's Medicaid, and it is education spending. And the last time I looked, healthcare spending is not growing at a nice predictable 2 or 3% a year like many of our other costs. It's growing anywhere from 10 to 17% a year depending upon what you look at. That promise made many years ago is a conundrum for every state legislature in the country. But it's even more of a strategic concern for us at the local level, particularly counties. Counties are administrative arms of the state. Basically means they can tell us what to do or they can give us their responsibilities. With the state not having access to revenues or not wanting to deal with revenues, what they're going to do over time is slowly but surely pass those costs on to your property taxes. They've already figured out a way to do it with schools. They're not allowed to have a state property tax. So they created this fiction called required local effort, which is really a state property tax. It shows up in their budget. But it's really a state property tax. They'll do the same thing. Medicaid already, we pay $55 a month for every Medicaid patient that sits in a nursing home, and we pay 1/3 of the cost of everybody that goes into a hospital that's there for more than 10 days, but less than 45, I think it is. So we're already paying for that. So just a little tweak in the formula, and you're paying more out of your property taxes. That is a huge expense that's being driven by costs that we can't control. We can control our labor costs. We can determine how many people we want to hire. We can't control, just like the judge can't control who walks into his courtroom. They get to come into the clerk's office and file. Can't control who gets sick, who gets aged, and what happens. So it sounds like a simple formula when you're dealing from a business point of view, but many of the things that government is given to do, we as your administrators or as collectively as a body of people, have no control over what drives those costs. It's that simple.